So we know since 1985, some patients have had options about surgery. We're talking about breast conserving surgery as opposed to mastectomy. There's some other factors that patients and their doctors need to consider. So there's been some new research out there that's pointing to new decisions that can be made. So Dr. Stover, why don't you tell us a little bit more about that?
Thanks, Victoria. In the same way that we're trying to identify just the right amount of medical treatment for patients with breast cancer, there's also great efforts to identify the right amount of surgical treatment for patients. One of the areas that's been a longstanding question is if a patient has multiple breast tumors within a single breast, is a mastectomy or removing the whole breast the only option for those patients? And there's some recent data, the Z1102 study, that was an early study that suggests that some of these patients may be able to undergo lumpectomy or breast conserving surgery with excellent outcomes. So this is an exciting area to try and optimize the amount of surgery and potentially avoid mastectomy in patients who prefer breast conserving surgery.
There's also some indications for patients who are looking at lymph node removal. And I know many patients have experienced the side effects of lymphedema. This is the buildup of lymph fluid in the fatty tissue that's just under the skin, and it causes a lot of swelling and discomfort. Happens in the arms and legs primarily, but also can happen in the face and neck and other parts of the body. So not a great outcome for patients. So what other trials are underway to help better identify patients who can avoid that?
Absolutely. It's really important to understand in what patients we can limit the number of lymph nodes that need to be removed from the armpit to minimize these long-term toxicities like lymphedema. Historically, all patients 20, 30 years ago had all of the lymph nodes removed. But work from the Z11 study in particular suggested that many patients could only require a sentinel lymph node biopsy or sampling 1 to 3 lymph nodes that drain from the area of the breast tumor. There's an ongoing study currently called A011202 that's looking to see how the interaction of removing lymph nodes and radiation might interplay. So for patients who have a positive lymph node, do we need to both remove all the lymph nodes and give radiation? Or is there a subset of patients that if we only remove 1 to 3 involved lymph nodes and give radiation, is that good enough that patients have good long-term outcomes, but with less toxicity? So I think that trying to right size the amount of surgery, not only in the breast, but also for the lymph nodes, is something that could improve long-term outcomes for our patients in terms of the potential side effects from those surgical procedures.
This is great. These are great outcomes, but also a great quality of life for patients, which is so important.